So I think you brought us back to the
I'm sorry
the
if I'm
theme
very
of…
abrasive.
No, no, no. You brought us back to the theme of inclusiveness.
Inclusiveness.
Yes. I want to ask you next about primary health care and preventive health, because after all, I come from WHO, and we have to remember that we have only about 10 years left for the Sustainable Development Goals to achieve health for all, that is the SDG 3. Now, health was enshrined in the very constitution of the World Health Organization, and health was defined even at that time, not just as a physical health, but also mental, spiritual, and social health, and not just the absence of disease, but of well-being. It was also stated that it's a fundamental right of every human being to attain the highest attainable standards of health, that governments have a responsibility of providing basic health care services to their population, but also that individuals and communities need to take active responsibility and cooperate in order to improve the health of the people. So we see now more and more countries, the heads of states are actually committing to universal health coverage. In India, we have the Prime Minister launched the Ayushman Bharat program last year, which aims to cover 500 million people with not only with health insurance, but also with primary health care services. But again, primary health care, many people think it's been interpreted in different ways. People think about it as an essential package of health services. People have interpreted it as just a selective package of health services which you provide only to the poor. And others have interpreted it from social and political and economic aspects. But the way WHO defines primary health care is, of course, to deliver the basic health services across the life course to address, again, not only treatment and diagnosis, but preventive services, rehabilitation, palliative care, long-term care throughout the life course, from the newborn to the elderly. And we have to appreciate now that the proportion of elderly is growing worldwide. And we will have by 2030 about 500 million people globally over the age of 80 years. And the most rapid increases are going to happen in Asia, Latin America, and Africa of elderly. How do you integrate them? How do you make sure they live good quality of life till the very end? But primary health care is also about making the right policies, public policies, like banning tobacco and smoking in public places, by making sure that there are water and sanitation services.
We're banning tobacco and make marijuana legal.
That's another debate, yes. And also the third element of primary health care is to empower individuals and communities, actually, to take action at the local level so that they can optimize their own health. They can advocate for policies. We see young people now, Greta Thunberg, the 16-year-old who has been advocating for climate change and who's actually managed to get heads of state to stand up and take notice of what she's saying. So I think a lot of hope now in young people. But people need to be co-developers of health and social services, but also they are self-carers and caregivers to others within their own families and communities. How can we integrate the practice of yoga and traditional medicine into our primary health care services so that they keep people healthy? It's not a question of treating illness once they're already ill. It's a bit late. Of course, there are medicines and things which you can use, but the aim should be to keep people healthy as long as possible. How do we integrate this, and have you had personal experience in India of being able to scale that up?
Now, the last part of your question is easy for me to answer. How to integrate yoga, how to make it available, large scale, various things are being done. But the larger part of your question, you will not settle with a simple answer from me, because better than anyone, you know the complexities involved in that. And as you come up with more solutions, people will come up with more issues. Let's say now you spoke about India, Ayushman Bharat. The wonderful thing is Prime Minister is taking two parallel ways. One is he's pushing yoga on one side and talking about insurance when you fall sick. Falling sick is not your privilege. Every human being needs to understand this, that it's not a privilege or your right to fall sick. You have no business to fall sick. But if it happens, it is only an emergency net. But in advanced countries, in Western countries, particularly I'm watching in United States, people think insurance is their privilege and they must exercise it. A nation with see, an individual person or a society or a nation seeks affluence. In the initial stages, because affluence promises choice of nourishment. In later stages, affluence brings choice of lifestyle. This is all human beings are seeking through affluence. So the most affluent country on the planet, which has a wide choice of nourishment and lifestyle, 70% of them are on prescription medication, spends over $3 trillion as healthcare bill. A country which has so many choices of nourishment and lifestyle should not have a healthcare bill like that, isn't it? Hello? But 70% are on prescription medication, the remaining 30% of course buying it off the back streets. Every nation is heading in this way as if this is the example to follow. Every nation is moving in that direction, that people are beginning to think, my health is my government's responsibility, or maybe it's the WHO's responsibility. No, every individual needs to understand my health is my business. If it goes wrong, somebody will support you, that's a different matter. But staying healthy is my business as an individual person. This is what yoga inculcates, that your health is 100% your business. You should not misunderstand the insurance net and government healthcare systems as a place that you need to go every day because it's there, it's your privilege to go there and exercise your right as a citizen. You have no business to go there as a life. As a life, you have no business to go to your hospital. You must live well and go straight to the undertaker. Yes You're going to the hospital because not enough attention has been paid as to how this mechanism works. The most complex, the most sophisticated machine on the planet is human mechanism. Do you agree with me? No, I'm not saying how complicated you are, I'm talking about the human mechanism. But the problem is most human beings are trying to live here without even reading the user's manual. So the initial aspect of yoga means, first thing is you read the user's manual. How does this work? What does what in this one? I was just talking to a group of American people, they said, Sadhguru, why there is so much ill health in America? I said, see, there are many aspects. Let me not go into a big talk about what are all the things you need to fix. I said, if you just allow me to redesign your furniture in America, you will see your healthcare bill as a person will come down minimum 30 to 40%. Just your furniture, the way you sit. Most furniture is made in such a way, if I go sit like this is the only way you can sit. You cannot sit like this. If you sit like this, you're inviting illnesses. Because, just to tell you a little bit, all of you know this, many of you are medical doctors, here is all the vital organs. None of them are fixed with nuts and bolts, it's all hanging in nets. Hello? Only if you sit like this, they all function to their best. If you sit like this, they'll all pile on each other and they will not function well. It's as simple as that. Especially with a full stomach, after lunch if you sit like this, it definitely you're asking for trouble. Now, like this, there are many things we can go on with. I'm saying small things, if we just understand how this works. Simple forms of yoga is just that. You just understand how your breath works, how your heart beats, how things are functioning, how you should sit, stand and breathe. If this much you understand, most probably you will never go to your doctor. But there are other influences, you're breathing chemicals, you're eating chemicals, drinking chemicals, exposed to so many things, there are infections, and above all, there is a population where hardly you find a space where there are no people. People are infection, you know. Hello? Once there are a group of people, there are chimneys of infections going on. Our bodies have to battle to somehow manage this stuff. If only there's enough space, if there was enough space on the planet, I think they're transporting all the men to the Mars, then I think the ladies can live well here. If there was enough space on this planet, that is, if the populations were little less than what it is, a whole lot of this healthcare wouldn't be necessary simply because there's simply little more distance between human beings. Well, we have not addressed that at all. United Nations made a prediction by 2050 we'll be 9.7 billion people. Well, they're going by the predictions, by looking at the rate of growth and the extension of human life, which is a wonderful thing. But why don't we plan by 2050 or 75 we'll be 3.5 billion people? We need a plan, isn't it? We are so smart. If we think there are too many elephants in Africa, we cull them. All right? Hello? We are that smart. How come we don't understand? If we extend or postpone our death, we also need to postpone our birth. How come we don't understand simple arithmetic? We got too much going in our head, too full of ourselves. We don't see that one of me is bad enough, I don't have to leave 10 behind. I'm not saying children are wonderful, all right? But we produce children, we must also leave a wonderful world for them to live, isn't it? If you create a nasty and harsh world, if you create a very harsh world and go, these wonderful children that you bear will become ugly animals, believe me. It's very important that we leave a pleasant and wonderful world so that they can fulfill their lives as wonderful human beings. Is this not important? So if we want to address healthcare without addressing population issues, I think we are not serious about what we're talking. We cannot talk about human health without addressing the population issue in a big way. Most nations have just given it up because it's religiously sensitive or whatever. Even in India, there was a family planning ministry. Now that has been transformed into family welfare. I appreciate the intention, but we must be able to gauge the realities of our existence, not ideologies of what we think, isn't it? In the beginning of 20th century, we were only 1.6 billion people. Today we are 7.6 billion people. In 1 century, this is not just because of reproduction, this is because human life, people are living more full. For example, in 1947 when India got its independence, the average life expectancy of an Indian was 28 years. Today it is 71, fantastic. We want it to become 91 if it's possible. Average life expectancy should be 85, 90, it should get there. But when we postpone death, we must also postpone birth. It is not compulsory that everybody must reproduce. This is coming because of a tribal mindset, what will I leave behind? It is because of this people want to accumulate things that they don't need. They want to grab everything, half the world they want to conquer because they got 10 children. This needs to go. A time has come where human consciousness should become more important than human biology. If you're identified with your biology, you're still having an evolutionary issue, isn't it? Hello? If your biology is the most dominant force in you, you're still having an evolutionary issue. It is time we think beyond our biology. Many of you who are here with your spouses or your partners, you didn't deliver your spouse, isn't it? but you're doing quite fine with them. I'm saying you can do quite fine with people that you don't deliver.
So maybe just the last question for this session could be, I think what you said made me think about a couple of things. Immunization, vaccines have been one of the greatest public health discoveries. In fact, one of the reasons why the lifespan increased so much
Yes, definitely.
is because of the availability of vaccines. We used to lose, half the number of children who were born used to die of pneumonia, diarrhea, and other infections. Today, that mortality has been brought down significantly thanks to vaccines, but also to antibiotics. But now, suddenly, we are seeing a different trend. If you look at the news, every day you hear about measles outbreaks, not in some remote corner of Africa, but in France, in Germany, in Ukraine, in the United States. In fact, the President of the United States and most of the mayors and governors have been speaking up about the importance of immunization. Because if you take a disease like measles, it's not enough for me to vaccinate my child and hope that it will be protected. You need what is called herd immunity. And to get herd immunity, you need about 90–95% of the children in that community to be vaccinated. So an individual action, a parent decides my child does not need a vaccine because of whatever belief. It's sometimes religious, but very often it's not religious. And a recent survey just came out a few days ago showed that people believed in the safety of vaccines 95% and above in Asia and Africa, but only 70% in Western Europe and even less in Eastern Europe. Only 50% of people, adults, believe that vaccines are safe. So this is beyond logic, it's beyond science, it's beyond any factual information that we give to people. It doesn't seem to be working. And yet, it impacts many others. You don't vaccinate your child, but the child who gets measles and dies may be somebody else's child. And so I think it comes back to what you were saying about it's not just yourself. You need to think about the humanity, community, society, and most importantly, the planet where we live and how we can modulate those actions.
This is a phenomena that we must observe historically or within families or individuals. Human beings get tired of well-being. They want some trouble. They like trouble, They like it really. See, America spent billions and billions of dollars to build highways, but now everybody buys off-road vehicles because people like some trouble. Too much order creates a certain level of irritation in the human being. He wants a little chaos. They must visit India. So, this campaign is gaining momentum particularly in California, big time. A whole lot of parents coming to me and asking this, I'm telling them, don't be a fool, because when you find your child is either crippled with polio or something else… I remember this very well. When I was in school, there were 4 children in my school. I never stayed in one school for too long. So I was there maximum 2 years, 3 years in any given school, 3 was the maximum. So in that high school where I was in one school for 3 years, in high school there were 4 polio-affected boys, 3 of them boys, 1 girl, who came to school in in a wheelchair, but many places the wheelchair wouldn't go in those days, so they would drag themselves and go. It was so terrible to see them. But today, even if you go to the remotest village in India, even if you go to the government schools where we work, there's not a single polio-affected child. It's fantastic to see that. So we don't know the value of these things. Unfortunately, we get tired of well-being. We want to invite some trouble. But having said that, I was talking to some of the parents in California. They were saying they're being put through some 40 or 42 different types of vaccines. They're saying it is causing learning disability, this, that, for all kinds of things. maybe in United States, and I don't know what's the situation in Europe, maybe they're overdoing it a little bit. Apart from treating the basic things which were affecting children, which would cause death or cripple, it would cripple a child, I think they're attending to trying to give vaccine for just about everything. This may be affecting. I'm not some kind of a medical expert or something to make a commentary on this, but from listening to the parents, this is what I gathered. I don't remember all the things that they said they're giving vaccines for. I thought some of them were just absurd. Some of those illnesses a child can go through, it's okay, he catches a flu, something happens. It's all right to go through those things when you're growing up, but they're giving vaccines for a whole lot of things which may not be necessary, which today parents are apprehensive, maybe causing learning disability or some other problem. It may not be connected, I don't know, but this is the fear that is being spread. But the power and the well-being that vaccines have brought to our lives, most of us are sitting here because we were vaccinated. Hello? Yes? Otherwise we wouldn't be here. Definitely we wouldn't be here, many of us. So, we should not… see, the problem is just this, especially now because social media and things, we either go this extreme or that extreme. I feel, being the World Health Organization, please look into this, I'm not an expert, but what kind of vaccines they're giving in… the spectrum of vaccines they're giving in United States, for example. If it is too much, I think WHO should tell them this much is not needed, this is compulsory, rest is by choice. If it's made like that, I think there'll be a more healthy proportion. Otherwise, some parents are just not vaccinating their children. I said, you must be crazy, you'll lose your child. Anytime it can happen, the child goes to school and that may be the end of it. But out of their, their fear that vaccine is going to damage their brains or something, they are going for this kind of decision-making. I think a clear statement from an organization like WHO would help parents to make a better choice.
Thank you, Sadhguru. And I just wanted to clarify that vaccines cause adults, that's what you said. None of us would be sitting here if it were not for vaccination. So let's think of vaccines as causing adults. And I don't think there's anything as too much of a good thing. So the problem has been the anti-vax campaign, skeptics who have spread many… There are side effects of everything. Everything has a side effect, but 1 in a million, maybe 1 in 2 million, but they have been blown out of proportion. And this gets circulated through social media. So social media can have both very good benefits, but also can propagate falsehoods very rapidly. And I think one needs to be always a little skeptical of things that we see on social media and check for ourselves the veracity. As far as WHO is concerned, we have absolutely very clear-cut guidelines on vaccination. And there is, as I said, very clear guidance both for the public and for practitioners on which vaccines are absolutely essential for all children.
But I think it needs to be more published.
Perhaps it has to be
more…
more…
Or if you give such knowledge to us, we will…
That will be wonderful.
Publish. Because when I spoke to the parents, their concerns were genuine. They're not those flaky, new agey types. They're genuinely concerned that this may affect their children.
You're right. I think the messaging probably needs to be done through people whom they believe. And some people believe the doctors, but maybe they also like to hear it from others. So
if there's credible scientific information…
yes.
And also clearly what is a must and what is choice.
What is
If
optional.
that is created, I think it'll be good.
Thank you very much
Thank
for
you.
this opportunity.
Thank you very much.
Namaskar.